Dr. Groves, I'm going to point this one to you again. Have you ever had any significant experiences with health insurance companies where the patient suffers, such as having patients being denied coverage or certain necessary procedures?
No, but for one reason only, because I go to battle for every one of them, all right? And that takes an incredible amount of time. I would say no, because when I find out that something's being denied or questioned, I am on the phone immediately, and I will talk to whoever I need to talk to and threaten whatever I need to threaten to get it done. And so far that I've been able to do that. Now, oftentimes I would set my minions onto that, as Cindy knows, because she used to work for me way back when. And so if the nurse couldn't get it done on the phone, then it would pass to me. And if I couldn't get it done with the first person I talked to, I asked for the next person up the list, and if the next person can't do it, I ask to speak to the attorney so that they'll know I'm sending them a letter from mine. And that has worked. But it is a tremendous amount of work, and not all of my colleagues are prepared to do that.
I will say in Tennessee, I don't do psychological testing here, but I did in Tennessee, and I was an intern at the time, and so people came, that was one of my job duties, was to do psychological testing, but I actually received no training in how to get it approved by what was TennCare at the time. And so I had to learn on my own that in order to get a client psychological testing that they needed, I had to figure out that they had a complicated diagnosis, and that therefore certain tests, would be justified if they had a complicated diagnosis. And I would have to go to bat every single time to get the client psychological testing that was necessary. Psychological testing is also a limited resource in Ohio, is my understanding, but I don't actually do it here.
Yeah, I just want to say that, you don't need my personal experiences here. We absolutely know that people are denied services every day, and this is not anecdotal experience. I mean, there are lots of stories out there, but we know from the research data that the uninsured, and more importantly, the underinsured. Underinsurance refers to the fact that it costs 10%, that your health care costs at least 10% or more of your income every year. So we have 47 million Americans that are uninsured, so they don't have access to care at all. So skip whether they're denied, they can't get in at all. And then we have another 50 million people who are underinsured, meaning they spend more than 10% of their income on health care. And they are denied regularly. This is 1/3 of our population, because we have close to 300 million people in this country. And then, let me just have a show of hands. Who here in the audience, not students, because you don't have to worry about anything. You have the best healthcare system in America. So, but those of you who deal with insurance, how many of you have ever had to get on the phone and talk with an insurance company? Look around you. Look around you. Now, even I can't believe that. No, I really can't believe it. But, I mean, every one of you pretty much raised your hands. I'm a patient too. I've had to get on the phone with my insurance company repeatedly. So it doesn't need to be anecdotal. It's out there. Everybody has experienced it.